Pediatric osteosarcoma. What is neoadjuvant therapy? When it comes to pediatric osteosarcoma, a common type of bone cancer in children and adolescents, neoadjuvant therapy plays a vital role. So, what exactly is neoadjuvant therapy? It refers to the use of chemotherapy drugs before the surgical removal of the tumor. This initial treatment usually lasts about 10 weeks and has several important goals. First, it aims to shrink the tumor, making it easier to remove surgically. Second, it targets any cancer cells that may have spread locally or microscopically, helping to improve surgical outcomes. After the neoadjuvant chemotherapy, doctors use imaging tests to evaluate how well the tumor has responded to the treatment. This assessment is crucial as it helps plan the surgery to remove the primary tumor. Following the surgical procedure, patients typically receive additional chemotherapy, known as adjuvant chemotherapy, to eliminate any remaining cancer cells and reduce the risk of the cancer returning. In pediatric osteosarcoma, neoadjuvant chemotherapy is considered a standard part of treatment. It usually involves a combination of powerful anti-cancer drugs, including high-dose methotrexate, doxorubicin, and cisplatin. These medications work together to maximize the destruction of cancer cells. The effectiveness of this therapy is often gauged by the percentage of tumor cell death, or necrosis, observed in the surgically removed tumor. A higher necrosis rate, particularly 90% or more, generally indicates a better prognosis. However, even patients with lower rates of tumor necrosis after chemotherapy tend to have significantly better outcomes compared to those who do not receive chemotherapy. Neoadjuvant chemotherapy offers several advantages. It can lead to a reduction in tumor size, which often allows for limb-sparing surgery instead of amputation. It also provides early treatment for microscopic metastatic disease, which may not be visible yet. Additionally, assessing how the tumor responds to chemotherapy can guide decisions about post-operative treatment. The typical treatment sequence for localized pediatric osteosarcoma begins with neoadjuvant chemotherapy for about 10 weeks, followed by surgery to remove the tumor, and then adjuvant chemotherapy for several months. Common chemotherapy regimens include combinations like methotrexate, doxorubicin, and cisplatin, often referred to as the MAP regimen. In some cases, other drugs such as ifosfamide and etoposide may also be used. To help manage side effects, protective agents like mesna may be administered alongside certain chemotherapy drugs. Overall, neoadjuvant therapy is a critical component in the multidisciplinary management of pediatric osteosarcoma. It not only improves survival rates, but also enables more effective surgical approaches. Treatment plans are tailored to each patient by oncology specialists, highlighting the importance of personalized medical care. Always consult healthcare professionals for advice tailored to individual circumstances.